I'm so empowered now to take complete control over how I'm actually allocating the money that I do spend on true healthcare. Something here is so wrong. I absolutely love what you're doing. It makes complete sense.
And so instead of asking you for all of it, we're just going to ask you for what the community needs. You get to keep the rest, which is a cool thing. When the health insurance plan, when the community does well, the health insurance profits. In CrowdHealth, when the community does well, you get to keep that money.
Welcome back to I Can Fit That In, the show where ambition meets alignment. Today, I am joined by Andy Schoonover, founder and CEO of CrowdHealth. Andy's journey into healthcare innovation began from a deeply personal experience. After his daughter needed a simple medical procedure, his family was left with an $8,000 bill that their insurance company refused to cover. I think we've all been there in some way, shape, or form. That moment led him to question the system entirely and ultimately build CrowdHealth, which is a company helping families find alternative ways to pay for and navigate healthcare outside of traditional insurance. I'm excited to explore Andy's perspective on challenging broken systems, building something mission-driven, and what it means to create solutions that truly put people first. Andy, welcome to the show.
Thanks for having me. Excited to be here.
Yeah, you're welcome. So clearly, I just gave a little bit of insight into why you started this, but I know that there's so much more to it. And your journey into healthcare healthcare reform, I would say, has started with this personal moment as a father, as a parent. And I would say that most people probably feel frustrated with this concept of healthcare insurance, but very few decide to tackle the system and rebuild the model itself. And so tell us your story, but also what gave you the conviction to really challenge something so deeply entrenched.
Yeah, this is actually my second healthcare company, and I swore that I was never going to do it again after the first time, just because of all the regulatory bureaucracy. And funny enough, I was selling into health insurance plans, my previous company, and I saw all the times in which they were making non-economic decisions, or at least decisions that didn't make any sense to me. And so I actually sold that company. And as such, I didn't have health insurance because most of us get health insurance through our employer. And so I wasn't employed anymore. And so I had the option of going on Cobra, which, as most people know, is like ridiculously expensive. And so I thought my only other option was the Affordable Care Act. And so I went on and I got something for me, my wife, and my two girls. And I think it was $1,100 or $1,200 a month. And I was like, all right, well, I guess that's my only option. And so I kind of joke it worked until I had to use it. My little one was, she was 1 at the time. And I did everything. She was having recurring ear infections. And so she was screaming, bloody murder all day and all night. And I was just like, so we got to do something about this. So we went to we had health insurance. So we had to go to our primary care doc first. And then they sent us to a pediatrician. And then they sent us to an ear, nose, and throat doctor. I was like, why are we doing all this craziness? I know something's going on with her ears. Let's just go straight to the ear, nose, and throat doctor. Yeah. But we went to the ear, nose, and throat and said, oh, she's got this fluid building up in her ears. It was popping her eardrums. And so he's like, no big deal. But it's a pretty simple procedure, but we have to get it done now because I'm seeing scar tissue build up in her ears. And so I was like, we don't want to worry about long-term hearing loss. I'm like, okay, great, let's go do it. So we did. We went in network. We did everything right. We got the procedure. It was 15 minutes. And then I got the bill in the mail and it was $8,000. I'm just like, wait, hold on a second. $8,000 for 15 minutes?
Asinine.
Like, this is craziness.
Yeah.
But this is what health insurance is for. Like, this is the whole point of having health insurance. And so, I just assumed the health insurance plan was going to take care of it. And I got something in the mail from the health insurance. It was snail mail, by the way, which is hilarious. It said
6 months later,
not medically necessary. And so they weren't going to pay for it. I'm just like, wait, hold on a second. I know it was medically necessary because before the procedure, she was screaming bloody murder. And now she's like sleeping like an angel. And so I was like, I know that this, ear, nose, and throat doctor told me she's got scar tissue in her ear. Like, what are you guys talking about? And so I went through 2 rounds of appeals. And at the end of the day, they're like, nope, we're not paying for it. So I had to stroke an $8,000 check. And at that point, I just called the health insurance plan. I was like, look, if you're not going to pay for my bills, I'm not paying your bills. And so I quit. And so I looked at my wife and I said, guess what? We're uninsured. And she kind of looked at me quizzically like, wait, what? And so we just kind of went through and was like, we got to figure out how to live without having health insurance because it's such, and from my perspective, and especially in that moment, it's such a scam.
Yeah.
And so we ultimately found out that like we started paying cash, just direct, with a credit card, and we were like, oh yeah, you get a 40% discount by paying us direct. And we're like, wait, what? I thought these big health insurance plans were supposed to be like getting the best rates. And what I found out is that they're not. Because these doctors have to go through just the rigmarole of like billing and pre-authorizations and all these kinds of things. They're like, yeah, pay us directly now and we'll give you a huge discount. And so I kind of like, I was like, I don't want to do this again. I don't want to do this again. But like, there's the higher being, I think, that was like, no, 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 I'm putting you in a place to go and do this. And so ultimately, I kind of came up with the idea of like, what if we got a big group of people together that would fund each other's bills so that we'd have the dollars to go and pay directly. And as a result, we don't have to, we could get rid of networks. We could get these discounts because we're paying directly. Like there's something here. And so I started the company in 2021. We just had our 5-year birthday a few weeks ago. And, it's just been incredible. I went from paying $1,100 or $1,200 a month to I think my family's paying like 440 or something like that this month. I mean, it's just
Yeah.
it's crazy how much less expensive it is if you can take health insurance out of the equation. So sorry for my long-winded answer to that, but that was kind of the context for how I got to a place of being like, somebody's got to change this,
Right. Right.
And really quick along the way, what I learned too is like something around like 200 to 250,000 families every year are going bankrupt due to a medical expense, even though they have health insurance.
Right.
So the whole point of health insurance is like to keep you from going into financial distress. And when I learned that like a couple 100,000 families every year were going bankrupt, even though they had health insurance, I'm like, this is clearly not working.
Clearly.
And so somebody had to go in and figure out how to change it. And so that was the kind of the impetus for me going out and trying to do this.
Well, thank you for the long-winded answer because it gives so much context and it makes so much sense that you were the one called to do this. So thank you for being that that person that stepped up to the plate. And as a consumer of CrowdHealth, my family and I started this year, and I was telling you before we hopped on to record the podcast how frustrated I was similarly as, my husband and I both own a business. We're self-employed. And in the years prior to that, yeah, it was easy. Just like, okay, we have, I call it medical insurance. I refuse to call it health insurance. But we have medical insurance from, the employer, and we were still paying easily $1,200 to $1,400 for a family of 4, per month. And then as self-employed, I went on and got this Blue Cross Blue Shield from the marketplace, this plan. And like you, I'm like, we go to an urgent care and it's $900, of which we have to pay $300. And I remember asking there, what if I just paid you cash and I didn't submit the insurance? And they said, well, you can't do that because you have insurance. And I am like, something here is so wrong. And by the way, I'm still fighting a $140 bill that they sent me a year later. Like, this is wild. So I absolutely love what you're doing. It makes complete sense. And for people that don't know, you're going to get also a code if you want to join CrowdHealth. You're going to get a code it'll be in the show notes. But for people that don't know, Andy, tell people just briefly how CrowdHealth works.
Yeah. So, as I mentioned, we got about 30,000 members now who all fund each other's healthcare expenses directly. And so, instead of health insurance, which, we can go into it, but there's so many perverse incentives with health insurance. They actually want prices to go up over time. They have an incentive to deny your bills. And so when I was starting this, I was like, man, I want to get rid of all the perverse incentives around this. And so we actually bill you twice per month. Once is $60 per person, and it's like a subscription fee. It's just a fee to be a part of the community that pays our bills, that allows you to we give you a care advocate. So you have a personal care advocate when you join. So instead of calling into call centers, you have one person you can talk to that is responsible and is held accountable for you to make sure that you're treated, well. I remember with my daughter's thing, like I was calling into the health insurance plan, and it was some foreign country, and I was on the phone for 20 or 30 minutes. And then I talked to somebody and they couldn't help me. And then I had to get punted to somebody else. And so that was 20 or 30 more minutes. I was like, if I had hair, I would pull it out, because it's such a frustrating experience. And so you get your own care advocate. we have a negotiations team as well. So if you do go to the ER, we will negotiate those bills for you, so you don't have to do that. And so that's what that $60 is for. And then on top of that, we asked you to help somebody else out in the community once per month. So for a family of four, it's max of 420 per month. This month, we're only asking for, I think, 225 of that 420 because the community is doing so well. We don't need all of your 425. And so instead of, or excuse me, 420. And so instead of asking you for all of it, we're just going to ask you for what the community needs. You get to keep the rest, which is a cool thing. In the health insurance plan, when the community does well, the health insurance profits. In CrowdHealth, when the community does well, you get to keep that money. So we never claw it back or anything like that. So you'll get an email once a month that says, a woman in Idaho is pregnant and needs help with, that pregnancy. And so you can say yes or no, or you can just automate it to say yes every time. And so that money goes directly from your account to her account. And so she then has the money to pay for that pregnancy directly to get those cash pay discounts. Some people are like, oh, okay, so is this like GoFundMe or something? Well, it's like, no, we have a community of 30,000 people who've raised their hand and said, hey, I'm going to help if somebody is having something going on with them. And so, like I said, you can say yes or no, but if you say no, then when you submit a bill to the community knows that you said no for somebody else in the community. So we're using like community dynamics to say, hey, let's hold each other accountable to helping each other out, because that's the only way that this works. And so that's ultimately how it works. It's very different from health insurance. I think it's cool because, when I was paying my money to my health insurance plan, I was like, oh, here it goes. The premium's going out the door again. Like, I have no idea where that's going. For this, it's like, no, I know I'm helping that pregnant woman in Idaho with, bringing a new life into this world. I'm like, that's awesome. Like, I love that.
Right.
We have oftentimes, pregnancy is our number one expense. We just have a lot of people in their, 30s and 40s who are just having babies, which is a super cool thing for me. But you have miscarriages that are a part of that too, unfortunately.
Mm-hmm.
It's just, unfortunately, just a part of life. And so whenever we send out funds to request for miscarriage, we have these women who come back and are like, man, like, I've been through that. I know the pain of that. I know what this woman is going through. Like, instead of $100 this month, can I give $200 this month? And it's just like, you would never in a million years call United Healthcare and be like, can I give more to you this month? And so there's just like really cool kind of personal humanity that goes along with your payment, given that you are sending it directly to somebody for cancer or a pregnancy or a broken arm or, whatever. And so it's way different than how health insurance, operates. And so we've done this, I think, 43,000 times thus far. And of the bills that we've sent to the community, 99.9% of those have gotten funded. And the 0.1% that hasn't gotten funded are the people who typically are like, hey, I'm not going to help the community, but I'm expecting the community to help me. So they're takers and not givers. Right. So we've had a way, way better track record of getting these bills paid than health insurance plans.
I bet. Yeah. I feel like what you're really doing is you're creating this sense of responsibility and transparency as well as community. And you don't have that in the traditional system, right? You don't have any transparency in the traditional system. You have your only responsibility is that you just keep submitting the premiums, right? And then they don't really hold the end of the bargain on their side. And then the community aspect is non-existent. And you're right, like with these healthcare advocates that you guys have, for my listeners, I mean, I literally have a person I email with. And I literally just email her and say, hey, Kelly, I'm curious about, finding a new pediatrician for my children. I've kind of gone to the one that the traditional insurance, paid for and, they, accepted them, et cetera. But I really want someone who's more in line with my values and my beliefs at this point. And I go to her and say, this is what it's going to cost for an initial appointment. Is this something that I can submit or not, and I mean, it's incredible. Like, she gets back to me like within like 3 hours and I have this person that I'm talking to. I love that aspect of it. You said something earlier, and I think this is an important thing for my listeners to hear as well, is that even my functional medicine doctor, I mean, there is still bureaucracy where they have to charge because they are utilizing systems. For example, when they submit labs, there's a whole system they have to go through in order to submit your lab order. And
Hmm.
because they have to do that, they charge a premium to you in order to submit the lab order. So what I figured out is here's the labs they want. I contact Kelly, my healthcare advocate at CrowdHealth, and I say, these are the labs they want me to get. And they say, okay, those will cost $472 from LabCorp. And we can submit that for you. We just need the doctor's order, right? So I'm
Hmm.
asking for the doctor's order, and they're saying, well, we can't submit the order. We have to actually submit it directly to LabCorp, and it costs,
Hmm.
$700. I'm like, something's backwards here. Why can't I just pay for
Yeah.
my labs directly, right? And of course, I have found a way around all of this because this is who I am. And so I now have my solution. But what I love in what you're building, have built, and what you're doing, and my experience of leaving the system, the broken system, is that I'm so empowered now to take complete control over not just my health, because I've been doing that for 15 years, and my family's health, but over how I'm actually allocating the money that I do spend on true healthcare, right? So that's a mindset shift. And I'd love to hear your perspective on why that mindset shift feels uncomfortable for people at first who may be considering this change.
Yeah, I mean, I think that ultimately people just don't like friction in life. And so and there's a little bit of, you know, just lay your card down and not have to worry about it, and unfortunately you're just delaying the inevitable, which is you have to worry about it when the bill comes in the mail. And so what we're trying to say is like, look, we've got a community of people who are taking personal responsibility. They're willing to do a little extra work up front so that they can pay way less, and so they don't get this explanation of benefits from your insurance plan a month from now and be like, what the heck, I didn't do that, or why is this so expensive? It's like, no, let's do some work up front. And in every other aspect of life, we do that. You wouldn't go and buy a car, without doing a little bit of research and a little bit of work. And so we try to reduce that friction as much as possible. But I think just people have gotten into this, candidly, a little bit of like apathy or laziness of just being like, I just want somebody else to deal with it. And I think ultimately, like when it comes to our health, we should stop relying upon the doctors to keep us healthy and take personal responsibility for keeping us healthy. Because the doctors only have 10 minutes with you, when you walk in. I mean, if you go a functional or integrative, they have a lot more time. But like traditionally in the allopathic world, like these doctors just don't have the time to do that, even if they wanted to, because our system is so screwed up. So ultimately what we're trying to do is like, look, let's lower the cost as low as possible. Like I said, my family's paying something like, let's see, it's 225 plus 240, so 465 this month. I'm saving $1,000 a month to versus health insurance. And now I have that $1,000 to go and get a gym membership. I can buy better food because I have extra money in my pocket. And I think we have a healthier population if we give it back to the people and let them use the dollars they want to use it for, as opposed to giving it to a health insurance company, which is they're using the money for God knows what,
Yeah.
And so I just think that we've got a community that requires some personal responsibility. And I mean, maybe that allows us or doesn't allow us to grow as fast, but I was like, man, I prefer to have a smaller community of people who take like true personal responsibility, as opposed to 10 million people who don't really give a hoot about their own health.
Mhm.
Like that just doesn't work.
Right.
And so we're just looking for those people who are like, hey, health is important to me. I'm willing to do the work in my 30s, 40s, and 50s so that I can live really well in my 60s, 70s, 80s, and
Yeah.
90s, right? Because we ultimately know that what we do in our 30s, 40s, 50s ultimately are, how we live the end of life. And I always tell people, I'm like, man, I want to live hard and die
Yeah.
fast. Like I don't want to live with a chronic condition for
100%.
10 years, before I die.
100%.
And so like, I think giving that money back to people and let them take personal responsibility over their health is just ultimately the right way of doing it. Unfortunately, we've kind of gotten, into this culture of being like, I want somebody else to take care of my health for me. And it's just, that's why we have 25% of our medical spend is going to people with, diabetes, most of that being type 2 diabetes, which is just a lifestyle issue. So,
Mhm.
again, another long-winded answer, so I apologize, but I get pretty hyped up on this
Yeah.
because I just feel like, man, we've got to like change the direction, or else not only we like physically
Mhm.
bankrupt, I think our country goes bankrupt because people aren't willing to take personal responsibility over their own health.
Yeah, and that's going to be like, I feel like a question I was going to ask you at some point, because, and this is good timing. When I think about the functional and integrative medicine doctors that I've gone to for 15 years, this is just a way that, my husband and I view actual health. Um, they've never taken insurance anyways, right? So I've always paid
Right.
out of pocket for that actual healthcare, which I believe is about
Hmm.
optimizing health and getting ahead of anything and being proactive. Um, but what do you think is going to change in the traditional insurance model over the next, let's just call it 5 to 10 years? Or do you think it even just kind of becomes obsolete? Because what we're seeing is that so many people in our age range, I'm 45, so like, people younger than us for sure, they view their health in a very different way, and they are far more empowered to take care of themselves than the older, generations were. So how do you see that changing?
Yeah, I mean, I think ultimately, our generation, I think the generation right behind us, I'm 47, so I'm right with you. I think are taking this a little more seriously. I think that we've seen a significant drop in alcohol sales over the last 5 years. I mean, I think people are start finally realizing like, hey, going home and having a bourbon every night probably is not the best thing for your
Yeah.
health, And so we have this generation who've quit smoking, who and all these things. And I was like, man, I think these people are going to be fed up with having to pay $1,400 or $1,500 for their family when they feel like, man, I'm taking care of myself. Why am I continuing to subsidize people who don't really take care of themselves? Like that's a frustrating type of thing, and paying that big check, and it's getting worse and worse. And so I think health insurance is in a death spiral. I mean, I
Mhm.
think it's starting. My fear. I don't make, I don't want to make a super political statement here, but my fear is that like Medicare for all is what the government's going to be like. Oh, well, just let us take care of it.
Yeah.
Let the government take care of you. And that's like even one step further away from personal responsibility.
Yeah.
And so I'm fearful of that, but I do believe that the health insurance is in a death spiral, and I don't think there's anything that we can do to change it. There's too many people making too much money off of the status quo, and so they're just gonna let that plane dive directly into the ground, I believe. And I hope that there's a place for something like CrowdHealth to exist, in the next decade or 2 decades, because I think it's imperative that we take more personal responsibility.
Right. And in that regard, I'm curious if you've had conversations directly with doctors and what their take is, and how they view what you're doing, which is disruptive in such a great way. And then the traditional system.
Yeah, I mean, I kind of joke that the only people who love us better than our members are the
Yeah.
doctors, because the doctors are like, please send me more, cash pay
Yeah.
patients. Ultimately they're feeling enslaved by these big health insurance plans, because if you have, 75% of your patients coming from, you know, Aetna or United or whoever, then they can just come back and be like, hey, I'm cutting your rates by 20% this
Right.
year. And you can do nothing about it other than go out of business. And so ultimately what these doctors have done is said, screw this, I'm tired of being in the game. And so they've sold their practices to these big hospital systems, which then, just negotiate with the health insurance plans, and they've got much better, bigger negotiating power to do that. And so what we're seeing is that these doctors who were independent and had their own practices are now part of big hospital
Mm.
systems. And I think that's a tragedy. I think it's gone from like 30% hospital systems, 70% independent, and it's now totally flipped, where it's 30% independent, 70% hospital systems. And so, ultimately, we think that these independent docs, who generally are better doctors from my experience, because they're the ones who can, operate these businesses without, a hospital system, funneling patients into them. The best doctors are staying independent, and what we're seeing is that the best doctors are also transitioning slowly to cash pay only.
Mhm.
And so I think ultimately what we're going to see over the next decade is the best doctors in the world aren't going to be in insurance plans. They're going to be cash pay. They're going to be like, look, I'm good. I don't want to deal with health insurance, so you got to pay me directly. I think ultimately that's where we're headed.
Yeah.
And so I think Crowd Health fits really well into that, because we pay in direct, we pay cash. And so the doctors love that. So I think you're going to have access to the best doctors in the world by paying directly. You're going to see a significant, kind of de kind of valuation of doctors, within the system. And so, ultimately, I think that's what's going to happen. It's going to take a little bit, but that's, I think, ultimately where we're headed.
Right. Absolutely. What I'm I'd love for you to share just briefly as well, like if someone has to go to the ER, how you guys handle that.
Mhm.
And I mean, it's very smart, and I totally get it. And it was one of the fear-based programs that was in my mind around having medical insurance and giving that up, right?
Sure.
Like firing the insurance provider. That was one of my concerns. Like, what if one of my kids breaks a bone, knock on wood, obviously. But then like, what do we do? So just walk us through that real
Mhm.
quickly.
Yeah, I mean, this is a fear that a lot of people have. We're like, oh, I'm going to go to the hospital and they're not going to take care of me. Well, there's a federal law. It's called the EMTALA law. We won't go into it, but it's basically saying, look, you can't discriminate based upon having insurance or not having insurance. And I've talked to, I bet you, 30 or 40 ER docs at this point. And I mean, I always ask the question. I was like, hey, do you even know what the insurance is of the person who comes in? Like, do you know if they have insurance or not? They're like, we have no idea. Like, the hospital keeps that from us so that we don't break that law. And because the fines for that are significant, they're severe. And so the doctors don't even know if you have health insurance. And so it's typically like a finance person walks in and says, hey, can I have your health insurance card? And you're like, I'm cash pay. And they're like, okay. And they're going to try to get you on like this care credit crap, all this stuff. And so what we tell our members is like, do not pay in the hospital. Don't take any discounts in the hospital because they try to emotionally manipulate you in that moment. In your moment of need, you hear, well, if you don't take the discount now, you're going to be paying $200,000 later, and you're like, no, don't do that. Ultimately, what happens with us is tell them to send you the bills, which we've done this thousands of times now. It works great. They send you the bills. You go to your app. You just take a picture of the bill. You let us kind of collate that on the back. We negotiate that for you on your behalf with the hospital. We get it down typically 60, 70, 80% because these hospitals will, try to gouge you. And we have attorneys on our team that do this for you. So when an attorney calls, they listen. And so we're able to negotiate it down. Once we get it negotiated, we go to say, hey, Erin, we got this negotiated down to $10,000. Are you okay with us sending it to the community? You're like, thumbs up. We send it to the community. The community then funds you $10,000. You then pay the hospital directly. And, you're getting a great rate as a result of doing that. Now, it's not just putting down your insurance card and then getting a, $50,000 bill later. It's like you have to do that one more step, but it's that step is saving you. Let's just say you have a $10,000 deductible, you'd be all the way through that $10,000 deductible, which is putting a lot of people into really financial distress. Instead, you let us negotiate it. You pay the first $500. We just ask you to pay the first $500 of any health event, and then the rest is submitted to the community for funding. And so it's just going to save you a ton of money by just doing one little extra step. And we make it as easy as possible. And from what we've heard from our members, it's like, man, that was awesome. Like the last thing I wanted to worry about when I was sitting in there in an ER bed is like, oh my God, I have to pay, $10,000 of this deductible, as opposed to like, focus on your health,
Right.
focus on getting better, and not worry about the financial, consequences of this, because you'll be out $500.
Right.
Like everybody can come up with $500. So that's ultimately kind of the reasoning why we set that up the way that we did, and it works really beautifully.
Yeah. And I mean, yeah, it's an extra step, but so what? You have complete agency over where your money's going. And you also then have agency over, these, not over the bills, but over how those get paid, right? It's like, this is
Yeah.
an extra step of just pure empowerment, not surrendering to the broken system. So I love it. Thanks for walking us through that.
Yeah. Like, by the way,
Yeah.
I had an ER bill, unfortunately. I was on one of these and I was talking, and then all of a sudden I couldn't put a sentence
Oh my
together.
God.
Like, I was like, I could not get words out of my mouth. And unfortunately, my dad had a stroke like 3 or 4 years ago. And so I was like, I thought I was having a stroke. And so I called, did the ER thing. I went in, I did everything right, but I got these bills and I'm like, I, they gave me an IV, for this just saline solution, which is just basically salt water. And I asked them, I was like, I had kind of gotten my wits back. I was like, am I dehydrated? And they're like, no, you're not dehydrated. We just do this for everybody. I'm like, okay, whatever. I got that bill, 1,000 milliliter bag of saline solution, which I can buy on Amazon for about $8.
Yeah.
They charged me $5,000 for a bag of saline solution.
Oh my God.
$5,000. And I didn't even need it. I didn't even need it. And so that's where,
Unbelievable.
CrowdHealth can go and be like, hold on a second. Why'd you give him saline if he wasn't dehydrated? It says in the doctor's notes, he's not dehydrated. Why'd you do that? They're like, oh, dude, and they're like, and so it's like silly stuff like that we can catch on our end that help our members because that significantly drives down costs. And fortunately, I just had a really bad migraine. So everything is fine. I didn't have a stroke. But I had a really bad migraine, which scared the crap out of me, as you can probably imagine.
Yes.
And I hadn't had that before. So that was the reason. But, ultimately, we got that bill down, I think 80 or 90% or something like that after it was all said and done, because these hospitals try to do a little bit of everything. I got so many stories. I don't
Oh no, I know you
so
do.
many stories with that one. I'm like, oh my gosh, like this is crazy.
Right. And I think what you're doing is you guys are negotiating those bills down to a fair and reasonable price. Like $5,000 for a bag of saline solution is not fair and reasonable. Like it's far from it, right? So what you are doing is negotiating what is actually just like right, what is acceptable, and no one else is doing that. And people as patients can't even do that on their own behalf when they are a part of the system. Right. So it makes so much sense. And I'd like to shift this a little bit to maybe you kind of personally and as a business owner and entrepreneur, that's building something so mission driven and purposeful in the lives of livelihoods of human beings. A lot of times that can come with resistance. And so I'm wondering if there's been moments of like pushback or, kind of questioning things or self-doubt even, and how you've navigated that. Like, have you ever felt like, gosh, is this too early? Is this too disruptive? Have you ever navigated any of those things?
Yeah. I mean, I don't know. It was maybe 2 or 3 months ago. We had this guy in a black car stop outside of our house like a half a dozen times. And then we got a note that says, I'm going to effing kill you all. And so we had to like get police like surrounding our house for,
oh my God,
a full day just to make sure that fortunately they got the guy and he has some ideological difference with what we're doing. And so, yeah, I mean, there's big time pushback. I mean, if you think about this is the $6 trillion industry, that we're ultimately trying to disrupt. That means a lot of people are making a lot of money. They're putting food on the table, that pays for a lot of food on the table. And so when people see their, ultimately their future and threatened, people do things that are just kind of crazy, and so we're seeing it, very kind of tangibly that way. And then, there's people online who, are like, you're a fraud, you're a scammer, you're da 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 da. And typically, I've gotten to this place. I was really offended by it early on. I kind of got into this place of being like, if you're calling us a fraud or a scammer, that's like the easiest way for you to be like a keyboard warrior, without doing any work to try to understand what we're doing. Like those people would not listen to our half an hour here and be trying like, let me just actually try to like intellectually figure this out. Like it's this emotional, like gut reaction to something that's trying to bust the status quo. And so anytime you try to bust the status quo, people are going to be really, really pissed off. And so, yeah, we got a lot of people pissed off, but ultimately, like, I believe in a higher power. Like this truly like burdens my heart for people who have to deal with this crap every day. It burdens my heart that 200,000 families are going bankrupt. We've had 0 people go bankrupt with CrowdHealth over the last 5 years. And so I feel like when you feel like this burden in your heart and you don't react to it, like you don't do something about it, then you just become a part of the problem. Yes. And so I don't want to be a part of the problem. And if like the higher being wants me to go before, my time, it's his time, not my time. And then like, okay, like, I don't want to leave my girls and my wife, obviously, but like, there's ultimately a place where you have to like, I have to go and do it, or else I'd be even more burdened if I've been given this calling from my perspective and not do it. So it is truly a mission for us. I mean, I sold my last company. I'm fine financially. This is not a financial endeavor. This is more like I want to truly like change the system so our families, my family, my girls, have something in the future that is they don't have to be enslaved and burdened by this system that's clearly built for, profiteering of others who don't really care about our health. So
Right.
ultimately that's where I come out with this.
Yeah, and what I love so much about what you're saying is that, I equate this to just kind of, let's just talk business in general, right? Like, corporate America. So many people are a victim to even that, and they feel like they have no other choice, and they can't, now you don't even have to leave corporate, but they feel like they're so stuck in this bubble or in this box that there's no other options for them. And,
Mm-hmm.
and I used to be in that mindset. And in my 20s, I was on Wall Street at Goldman. And I always felt like I had those handcuffs on, like there was nothing else I could do.
Yeah.
Even moving within the organization of 80,000 people seemed like almost impossible. And meanwhile, I had migraines and, reactions to stress that were just ridiculous for someone in their 20s, because I reported to this terrible, terrible person, and she made my life a living hell. Well, that's like,
Yeah.
that's on me. I didn't have to continue to deal with it. I could have made changes, and it took me 3.5 years to make a change. But we're not a victim to anything. I mean, within context, right? Within context of the listeners here, we're not a victim. And so taking back that agency and that ownership over your life, healthcare is a part of it. Your job is
Yeah.
a part of it, like where you choose to live and where you choose to put your kids in school, and like all the things that you do in your life, you have agency and ownership, and you have to step away from and out of victimhood to really start to see it. But then guess what? It takes action and effort. And so
Yeah.
that's the real kicker there, right?
Yeah, there was a study that came out. Something like 2 to 4 million Americans would go and do something entrepreneurial if they weren't handcuffed to their employer for health insurance. Like they are not going and doing something entrepreneurial because of health insurance. I'm like, man, I love the fact that we have like our number one category of people are
Yeah.
entrepreneurs. Like they're freelancers and gig workers and small business owners and like things like that. Is like, that's awesome that we can like enable people to go and do something. Or we have a lot of people who are like, I just had a baby and I don't want to have to go back to work for health insurance. I want to stay home with my kid and I don't have any other way of doing that. And then I saw CrowdHealth and I'm like, oh my gosh, like I actually found something affordable
Yeah.
so that I can stay home with my baby. I'm like, God, which is the most important job in the world from my perspective.
Mhm.
And so I'm like, amazing. Like let's give people the opportunity to have choices,
Right.
that they can do what they want to do with their life and not get shackled in by big employers. So
Right.
that's a whole nother conversation in terms of employer health insurance and things like that. But ultimately that's what we're trying to do, is enable people to make choices that allows them to thrive in whatever way they want to do that.
Awesome. And then Andy, I'm curious, as we kind of close out here, what personal I talk a lot about rituals. So what rituals, meaning intentional choices and kind of daily things that you do, or even weekly, what are those things that you have in your life that have helped you stay grounded in such a controversial industry? And clearly you telling us that story about this man outside of your house, like some of these stressful times, what really keeps you grounded and keeps you going?
Yeah, I mean, I think ultimately, my day looks like I'm an early riser, so I'm usually up at 5 or before. The first typical hour of my day is what I call quiet time,
Mhm.
or alone time. Me and my wife kind of go in separate areas, and we both have our own like alone time. And then for different people, it looks different. It can be meditation, it can be
Yeah.
prayer, it can be like journaling, it can be those types of things. But I feel like that's such an important part of getting stabilized for the day, for me personally and for my family. And then I think working out after that, so it's an hour of quiet time, an hour of working out. And I feel like if I can do those two things during the day, I can be a better dad, I can be a better husband, I can be a better leader within the organization. And so I think that's really important. And also, like, I'm super passionate about marriage, and
Mhm.
so my marriage is really important to me, is because if that's not good, then everything else kind of falls apart. And so just being very, very intentional around, trying to love my wife well, and we're all sinful human beings, but kind of loving each other kind of through that, and that's a super stabilizing part of life as well.
Yeah, I mean that there's so many great nuggets in what you just shared, and I so agree that morning time, like whatever time in the morning it is, if you have young children, it's going to be a lot earlier than if you have older children, right?
Yeah,
Or if you have no children. Um, but that time alone, there's not many places you get time alone once the day starts, right? Like once the world awakens, your energy is just being pulled in a million directions. So being very intentional about how you set yourself up for success for the day is crucial. And I love that you shared that one. And then yeah, I mean marriage, like it's not easy, but if you don't put some intention into it, like it's not going to do well. So you have to really be
yeah,
focused and intentional with that. So thanks for sharing that one.
yeah,
Um, any
yeah.
last thoughts that you would leave the listeners with when it comes to time or agency or just being more intentional, like you just shared?
Yeah, I mean, I wish I, had a great Tony Robbins quote or something. Unfortunately, I don't. I think you hit it, which is just like, we get into this mindset of being victims, and even if we say we're not victims, I find myself personally just naturally falling into that victimhood, and so it's like you have to continue to like remind yourself, I'm not the victim. I can control my emotions, and I think that oftentimes like people think of emotions or is just like, oh, well, I have to just follow my emotion. I'm like, no, no, no. Like your brain often lies to you. And so you have to understand that and be intentional around like, hey, like, where's this coming from? Like, why is this emotion the way it is? Am I trying to defend myself, or am I really trying to get to the bottom of what is going on with me? And so it's just like this continually like questioning yourself around like, am I being the victim here, or am I really trying to intentionally figure out what's going on with that emotion? We're all emotional human beings. And so and that's what a great, amazing blessing that is to be emotional human beings. But it also can also, like get into this self-preservation, selfishness,
Yeah.
and you have to really like be really focused on that. So I always tell my kid that like your brain is going to lie to you.
Yeah.
Make sure you understand that, and that you really question where these emotions are coming from and try to get to the root cause of it. So, I like I said, I probably wouldn't make much money being like the Tony Robbins type, but I just that's just like my thing is just like I don't be the
Yeah.
victim, and really try to
Yeah.
start with my brain is lying,
Right. Right.
because I think that's a really great place of
You were
starting.
speaking my language, and don't worry, I'm more the Tony Robbins type, but a much more modern version. But yeah, I mean, the ego is always trying to seek reward or avoid pain.
Yeah,
Always. It's
yeah,
one or the other. It's not both at the same time. It is one or the other. And so somewhere in between there lies the truth, right? And you can only get to the truth by listening to what's within you in a deeper place, right? Not what's going on up here. So
yeah.
thanks for leaving
Well,
that
I
one.
think that
Yeah.
also real quick,
Yeah.
you brought the pain, like, and
Yes.
we're so averse to pain. We're so averse to pain, and I'm like, man, real growth happens during painful
Yeah.
times.
Yeah.
My wife and I lost our first daughter 10 hours after she was
Oh.
born. And as you can probably imagine, the most painful
Mhm.
experience you could ever imagine. And we went through 2 years of hell, but I wouldn't give that 2 years. I wouldn't redo that 2 years. I wouldn't want it to have happened any different because there was so much growth in those 2 years. I think my daughter who left us is in a better place now. That's good. I think our marriage is in a better
Yeah.
place. My personal beliefs are stronger now than they were. I have a much better kind of understanding of how pain works and operates in our lives. And it's like, if you, at just a fundamental level, if you go and work out every morning and you're not feeling pain, you're not
Yeah.
growing, right? Like you have to feel pain in the gym to grow physiologically. And I think emotionally too, oftentimes, like if we can just embrace some of that pain
Yeah.
and say, man, this is a great opportunity for me to learn, as opposed to saying, woe is me for having this pain. I think that's the difference between thriving and then sitting in this place of just being encumbered by all of this pain. So hope, I think, ultimately is the answer. And so if you can sit in pain and be like, man, I know I'm going to get out of this. And if you can set your brain up to say, I'm going to get out of this better than when I entered it, it gives you a little hope to be able to get through some of that pain.
Yes.
And this is just coming from somebody who lost a child. So I'm not, standing in my pedestal here. It's more like, no, I've lived this. And so I hope people will take that. And if anybody listening is in pain, like, have a little hope. You're going to come out of this as a better human being if if you're intentional about it, as opposed to being like, man, I'm going to live through this forever, because you won't. You will get through it.
Right. And like building that resilience through it is so powerful. And the growth is on the other side, right? It's the
Yeah.
pain and the discomfort is what leads to that growth on the other side. And it's hard for people to see that when they're in it. But you just have to, like you said, tell yourself that and have that belief and just create the belief, because a belief is nothing but a thought you have on repeat. So just start thinking it, and put it in your
Yeah.
own mind. It's not going to arrive there by accident. I tell that to people all the time. Beliefs will not just arrive by
Amen.
accident. You have to really start to put the ones that you want in there. So what a great way to
Amen.
end this episode. That was wonderful. So Andy, real quick, where can people find you?
Yeah, www.joincrowdhealth.com. You can sign up whenever you want. You can leave whenever you want. You don't have these stupid open enrollment things, so it's super easy. It takes 5 to 10 minutes to sign up, or join Crowd Health on any of our social media platforms. We're pretty sassy over there, so if you like sassy thoughts on our sick care system, go on and follow us. We'd love to have you. So yeah, joincrowdhealth.com.
Awesome. Thanks for being here, Andy.
Thanks for having me.
Yep. And everyone, you know what to do. Please like, share, subscribe, and rate the show. Let's get this to more and more people who could really benefit from these conversations. And until next time, be well.